now is turned to James Fishkin, who's professor of communication at Stanford University and director of the Center for Deliberative Democracy at Stanford. As we've said, community consultation is kind of at the center of the RAND network. But actually, consulting communities is not necessarily as straightforward in that. You know, who speaks for the community? What does a community perspective mean? What community are you talking about? Polling doesn't do it. Straight polling or even door-to-door question and answers doesn't quite get at it. And I think Jim is going to talk about the process that he developed, deliberative polling, which overcomes some of the drawbacks to kind of traditional gauging of opinion. Jim, why don't you start out, and we'll turn to question and answer following your presentation.
Great. This is on. Well, thank you so much. How do I advance the slides? What? I'm pushing. Oh, here. Okay. So let me describe, as Jennifer said, I've got a lot of slides, a lot of details. We've done 3 projects now in Africa, and I'm very happy and privileged to be part of this RAND network. I'm very grateful to USAID for supporting this work, because I've been doing this kind of work we've done it in 21 countries, about 70 times, but I've always said we could do it in Africa, and people were skeptical for reasons, and it worked perfectly, nearly perfectly. And this is what I want to share with you. What is the problem? Let me summarize a little bit, and then we'll go through whatever details for whatever time Jennifer gives me to discuss the details.
You're a little over time, so brief is better.
Well, I'm just starting, so I can't be over time yet. The simple problem is how you consult the public. Of course, you might say, if you want to consult the public, just ask them. But if you just ask them, let's say, to show up at a meeting, you'll get the people who feel very strongly. You'll get an unrepresentative sample of the public. If you don't have any structure to the meeting, you may just get the people who feel really strongly dominating everybody else. If you do polls, polls are a good way to consult the public in a representative way, but not in a thoughtful way, because most people, most of the time, are not motivated to become seriously informed about public policy issues. There's the famous phrase of Anthony Downs back in 1957, individual voters and citizens are rationally ignorant. They have one vote in thousands, tens of thousands, or millions. Why should they spend their time becoming informed? But we would like citizens to become informed about their communities and their societies so that their public opinion is meaningful. If you do focus groups, they're too small to be representative. Focus groups typically are 8 or 10 people. They're quota samples. They also try to reach consensus, which has some other issues. Focus groups are meant to be suggestive. That's what Robert Merton meant when he invented the focus group, which you can see described in a book he wrote, Robert Merton at Columbia years ago, called The Focused Interview. They're meant to be suggestive. They're not meant to be representative. So the work we do is built on top of all the work that was described so far. That is, the focus groups, the key informant interviews, the voices from the public. And by the way, this work is situated, I think that there's been a long development, increasing emphasis in development work to be inclusive, to hear the voice of the people, as David said at the very beginning. But how do you do it? And it began with stakeholder advisory groups, stakeholder groups, but they don't speak for the people. They speak on behalf of the people. Then there's participatory work, like the participatory budgeting, which is spread around the world. But those are self-selected, so they're unrepresentative. The question is whether you can do the kind of thing which I characterize and others characterize as deliberative democracy, which is representative and thoughtful at the same time. It gets over this dilemma that the focus groups and the public meetings, those people may be informed, but they're not representative. The polls may be representative, but they're not informed. How do you get both? Well, it's a very simple idea. So built upon, on the top of all the hard work about the themes in each of the labs, we have in 2 of the labs taken those themes, convened the kind of stakeholder advisory group that are expert on the policies that might be ripe for action to address the environmental variability, to address the problems of too rapid urbanization. The environmental variability was in Uganda, the too rapid urbanization was in Ghana. Policy proposals that might be ripe for decision. Then the advisory group develops an agenda, briefing materials, arguments for and against that the people need to be informed about to begin a discussion, not to end it, to begin it. And then, because the populations are not literate, as in other deliberative polls, or there's a lot of illiteracy in the low level of literacy, we developed video versions of the briefing materials to present. We convened the samples. They deliberated for 2 days under the basic idea is you take a representative sample and you engage it in serious deliberation. Deliberation means weighing the competing arguments, becoming more informed, considering all the pros and cons. And in small group discussions that are moderated, they identify key questions that they want to ask. Those questions are directed at competing panels of experts who answer from different perspectives, who answer the question. They don't give speeches. They only answer the questions the people urgently want to know in order to make a decision. Then they take the same questionnaire. There's a questionnaire on first contact and then a questionnaire at the end of the process, and we see the changes of opinion. And we usually get lots of statistically significant changes. We also tape the small groups so that we have all the qualitative richness of focus groups, but all the small groups added up are a representative sample. So then we can code those small group discussions and we can see the reasoning and the factors behind the opinion changes. And if we have room in the questionnaire for the right explanatory variables, we can also do regressions to explain the levers of opinion change. So we did all of this. Let me move through my slides. We did with Makerere University in Uganda and UDS in, so we've done this around the world about 70 times in 21 countries. So let me briefly describe what we did in Uganda and briefly describe what we did in Ghana. In Uganda, we worked in the Mount Elgon region, which is subject to environmental disasters. In Bududa, in the mountainous areas, there are rock slides, and in the lowland, Budaleja, there are floods. These periodically wipe out parts of the population. And they pose a real challenge because the people come back. Why do the people come back? Because it's very fertile land. And it's a highly populated area. As I recall, the average population density in Uganda is 175 persons per square kilometer. The average population density in this region is 950 persons per square kilometer. These are households with many wives, many children. The women mostly do not receive much education. There are real challenges. So we included population pressure as one of the themes, but we also included relocation and land management. William mentioned the problem of land management in terms of people not wanting to build trees because they thought they would lose their land. That's not true, but that's the way the public understood it. So the first thing is to get a good sample. And here the results were really rather incredible because given the gold standard method for getting a random sample is to do random selection of households and then random selection in the household of adults. And that's a good way of getting a random sample. When I did the first deliberative poll in the United States with the National Opinion Research Center, the University of Chicago, we did that in the United States with PBS. It cost a fortune, but it worked great. We did it in Uganda in a cost-effective way with the energetic graduate students at Makerere University and research assistants. And look at this. In Bududa, there were 210 initial interviews. Only 11 people refused to take the initial questionnaire. Of those 210, 201 completed the 2 days of deliberation. Similarly, in Budaleja, 232 initial interviews, only 11 refusals, 217 completed the 2 days of deliberation. So by the standards of public opinion polling, Deliberative polling is built on top of conventional public opinion polling. This is incredible. I tell this to my survey research colleagues. They say, what planet is this from? So, in other words, we are getting really good samples. And then what happened? Well, that's a small group. In Bududa, they didn't have a place where the people could meet in small groups. Usually we do this on a university campus or in a hotel where we have plenary sessions where the 200 or 300 people meet together to pose questions, and then small group discussions where they deliberate for hours. We had to get tents for the small group discussions. And by the way, there were observers. We always have observers, but here a lot of the observers, and I wanted observer badges to put on them, were sheep and goats. They were working through and they were very well behaved. They didn't interfere with the discussion, unlike some of the human observers. And that's the group gathered together. Actually, that's a photo from my iPhone. I want to tell McCary I want some better photos than the ones I'm capable of taking. But we got lots of, that's a simple, I can't go through it. Raising funds to support the work of the local disaster management committees was a big change. Well, why is that? The last time they had a disaster, it took 8 days for any response. Why did it take 8 days? Because the central government controls the disaster management. The local committees are, the communities are organized, but they don't have any funds. It came out in we revealed the results in Kampala and in the Mount Elgon region, and it was remarked that it took 6 days for McCary's super grass to grow to feed cattle, as William said. But it took 8 days for the Disaster Management Committee to respond. So they wanted they wanted to make them real committees so the community could involve. Support the idea that families should consider their resources in planning the size of their families. I listened to one of the small groups where this man said that he had 18 children, 14 boys and 4 girls. He had to divide his land among the 14 boys to prepare for the next generation, and he now thinks family planning would be a good idea. So we have quotations from the small groups. You can understand qualitatively and qualitatively. In Budaleja, the experts said, well, there should be an early warning system for the floods. We'll use text messaging. No, the text messaging went down. People said the cell phone system's unreliable. So it's hard to be sure of electricity. There could be a flood. I might never hear the warning. We want sirens. There are sirens for the early warning system. We'll hear the sirens. And notice the change from rezoning high-risk areas for no settlement. Before deliberation, only 46% supported that. After it was 20 points higher. They were willing to buy into rezoning for no settlement in the risky areas. And look at the increase in support for government enforcing the minimum age of marriage. Let me say a couple of things about the health center, too, is really interesting. So an idea of the kind of trade-off that we were able to discuss. Because we convened with these results, to release these results, we convened both in Mount Elgon. I went out there with the McCary team, and we talked to the district leaders in Bududa and Budaleja. Each district has about 200,000 people. And then we had a national meeting with the Prime Minister's Disaster Management Committee, the commissioner in charge of disaster management, all kinds of important officials. And by the way, for the national meeting, the district leaders were so excited about the results that they drove the 5 hours all the way in to Kampala to come to the other meeting in order to say how strongly they felt about implementing the results. But just to give you an idea of the kinds of trade-offs, for both education and health care, the district-level officials had been in the process of centralizing, because the idea was the schools aren't very good, but we consolidate the schools, we will build bigger and better schools. but of course people have to travel farther. And in the case of the health cares, they were closing down the so-called health center 2s, the very local health center, in order to build bigger and better health care clinics. Now, in family planning, we discovered that one of the main reasons the women did not want to engage in family planning is they had a number of ideas about what could go wrong, and if they have to travel 2 hours to get to a health care clinic, they didn't feel comfortable engaging in clinic. They wouldn't have the medical care support. So the very fact that the health center 2s were closing was a disincentive for family planning. And the fact that, and the young girls are not getting any elementary school education because if they have to travel too far, then there's fear, the parents fear that they're going to be raped while they're going to school. So one of the ideas that got a lot of support was very small classes for elementary schools in the villages. And people debated, well, could these be staffed, et cetera, but there was big support at the end for one-room schoolhouses in the villages so that the girls could get some education as well as the boys. So the district leaders, when we presented these results, they said, for both districts, they said, well, we have been moving to consolidate the health center and to consolidate the schools. But now that we understand the disparate impact on the women and the girls of consolidating the health centers and consolidating the schools, we think we should start decentralizing again. So, look, the district leaders were making a perfectly reasonable trade-off. It was a perfectly reasonable thing for expert opinion to conclude that we could have bigger and better schools, bigger and better healthcare centers, but they needed to listen to the voice of the people to understand the impact, the real impact on that result. So all of our results are about the public considering the trade-offs from their perspective when they're informed, but a representative sample doing that. And we think that we will get implementation of these results because all these stakeholders bought into the agenda beforehand. The agenda was based on all the other work before, but then they bought in. These are policy choices that were ripe for decision. Well, now we listen to the people, and hopefully we will get decisions. And I think that the commissioner and the gentleman from the Prime Minister's office, they said, this gives us a shopping list of things that need to be done because the problems in Bududa and Budaleja have been long-standing. Let me turn to Ghana. And in Ghana, we had 208 participants out of 243. And by the way, only 2 people refused to take the initial interview. So in terms of a sample, it's demonstrably, it's an excellent sample. And there were 39 policy proposals, 29 changed significantly. You can't read all that, but let me give you an example. So if you look at a map of Tamale has grown from a couple 100,000 to 450, 500,000, depending on the estimate of the population. And the problem in Tamale, this is in the northern part of Ghana, which is the poorer part of Ghana, is too rapid urbanization. There's and our themes were water, sanitation, health, livelihood, and food security. And these are urgent problems. So if you look at a map of Ghana to see where the vegetable gardens are, and you juxtapose that, as we did in our briefing document and the video, with the map of where the public latrines are, they're the same places. Because that's where people are getting their water to grow vegetables. There's an urgent lack of water. So there was a significant increase in support for banning the use of untreated wastewater for growing vegetables. Now that's an indication of a real trade-off because that involves sacrifice. Because people have to get food somehow. There was also a big increase in support for something which, to show you the convening power of this, the way this works, when we had the advisory group, we had the presiding member of the municipal assembly, that's the local government, we had NGOs, Red Cross, all kinds of experts, many very excellent experts from the University of Development Studies, UDS, thinking about the policy options. So when we were talking about the lack of clean water, lack of drinkable water, one of the experts said, well, there should be rainwater harvesting, because there's a lot of rain in certain periods, and then there's no water at all. And in the schools, as we showed in the video, when there's no water, the teachers send the children out for schools, but they find polluted water. So there ought to be rainwater harvesting. So at that point in the advisory group, the presiding member hadn't said anything at all up to that time. And then he intervened, and he said, if the public wants those tanks for rainwater harvesting for the schools, I promise you, I will make the municipal assembly pay for those tanks. Well, the public really wanted those tanks for rainwater harvesting, and I'm planning with Dennis, who was a fantastic partner in this, to go back to Tammany for a meeting with the whole advisory group to release the results, and I'm going to say to him, now can we get those tanks? And there's a whole bunch of other such results. So I should say that when we evaluate these results, you see the people. You probably can't even read. Oh my goodness, they're hard to read. I'm sorry, but there are evaluations, and of every aspect. And it came out as well as in any of the developed countries where we have done this. And people have said, Marketan Humphreys wrote that article about how you couldn't have deliberative democracy in Africa because the moderators would just tell the people what to decide. Not in our case. We have evidence to that effect. Or that the people, earlier when I tried to do this, people said, well, deliberative democracy is for highly educated populations. No. The people in these populations, these communities, they can deliberate as well as anybody about the issues affecting their communities. And you just have to empower them by doing the staff work on the issues and making the information available and making the competing experts available. And through discussion and random sampling, you can convene a microcosm of the population, and they can chart the path to informed buy-in for the policies. It's a path to responsible, evidence-based advocacy for. So basically, you see, when we convene the advisory group, we convene the decision makers with a random sample of the people. So we don't have this problem of self-selected groups that behave like angry voices. We don't have this problem of polls that are uninformed. Rather, we can get results that, and I think in these 3 cases in Africa, the results will actually be implemented. And then it can set an example for other places. Okay, I've run out of time, so thank you.